So that's why, Frank, I think one of the big pain point in this field is integration, and that's why I think there is a whole big business around that vertical because all these systems that as you was rightly saying, that there are hundreds of systems, they all are built on different technologies. All right, I think let's get right into it. I was looking at your profile, and you have an impressive experience in healthcare space. And I was also going through what OptiCare Connect does, and you are in occupational health area. So I think it would be, Frank, great starting point for us if we talk a little bit about your past experience, what challenges you have overcome to your own journey, but more importantly, if we can connect that with your vision for OptiCare Connect, I think that would be a good starting point for our conversation.
You want me to go into it right now
Yeah, please,
to
if
start?
you don't
Sure.
mind.
So I am a nurse practitioner and the founder and partner in an occupational medicine clinic.
Let's get back to we were talking about some of the limitations or challenges you are running into with your current EMR you are using. So I wanted to ask you what's your roadmap for finding workaround around that or solutions around those
So
challenges?
with this business, it is a 100% computerized, essentially. Everything we do is on the computer. And so you would think that that would make this a very easy platform to function in. But from our perspective, um, it is very difficult to extract um, information from the computer charting in order to provide our clients with the type of analytics that they're requesting, and even further into predictive analytics. There's absolutely no possibility from that. It's all a manual process.
Right. So if we talk about predictive analysis, that information you are looking for, exactly the type of data you are looking for, if you have to provide a little bit of hint of what exactly you need in that analysis, and what sort of information you are
So
looking for.
if you would imagine you own a company that has 30 different locations, and you would like to know if there are an influx or an uptick in certain types of injuries, say crush injuries of the fingers at one facility that you're not seeing elsewhere. Unless we are manually recording on a spreadsheet each injury and eventually running some analysis of that, there's no way to quickly get that information to the client currently using the platform that we have. But that's the type of information that they would like to see. Is
Got it.
there a problem at one company, at one location, or are there trends that we should be aware of?
Absolutely. So I think one big challenge right now that is being taken care by AI and technology for many healthcare companies is administrative and operational side of the things. So, how does your current administrative or operational workload look like, and do you feel that you are using enough technology to address those areas? Because I think more and more companies are transitioning into tools that are helping them do that instead of workforce or manual
We are
interventions.
currently having to do a lot of manual interpretation and data gathering. We would love to have, and as I mentioned, we're looking to build out a system that would provide both an outward look for our clients in real time, so a dashboard and a portal for their records, along with um, their ability to run their own analytical data on what we're pulling into the system from the encounters.
Got it. So, Frank, how big is your team right now in terms of if we consider the full workforce on all side of the all the departments? How big is your team right now, and is team
Team
expansion on
expansion
your
is
plan
on
for
our
this year?
plan this year. Believe it or not, we have around 10 employees. We're able to do this because of the platform. We have a team of providers and case managers, and then along with administrative staff. And so we're a relatively small team. I believe we had around 300% growth last year. Looking to definitely expand upon that this year.
Right. So, if you have to um, because in your day-to-day job, what do you feel is the biggest frustration or problem that come up and that impact your that is very critical
Oh,
to
the number
your
one issue
business?
would be if for some reason there was a downtime with the software. I mean, that's catastrophic. The company has been very good about
Right.
rapidly addressing and trying to get the software back up. It doesn't happen often. Another another key would be the communication piece between um, our employees and providers to referral clinics. Everyone is different. Everyone has a different EMR. Some are still not using EMRs, and just the process of trying to communicate effectively and transmit data from us to them is a challenge and has to be built out specifically when we develop relationships with them. But every one of them is different. And you're talking about 1,000 clinics spread out across the U.S. They're all different, all interfacing differently. And
So that's why, Frank, I think one of the big pain point in this field is integration, and that's why I think there is a whole big business around that vertical because all these systems that as you was rightly saying, that there are hundreds of systems, they all are built on different technology specification, different technology stacks, and they don't communicate well with one another. So there is always a need for a middle layer to create a general standard where all of them can communicate and data can flow between them effectively. So integration is, I think, it has been a biggest pain point for overall healthcare for a good while now. And of course, with AI and all those technologies coming in, I think those technologies are helping more on administrative and operational side of the things, but still, integration part is not very widely penetrated by AI tools and AI technologies. And I think there is a lot of need for improving those. So if you are able to connect seamlessly with other systems, this is going to help all the entities, all the stakeholders. So do you feel that you have the right, first of all, energy and right budget to focus on integrations this
do I
year,
feel we have the right
or
mindset
the
to focus on
time that is coming
integration this
ahead?
year? I would think that that is going to be part of our build out. Probably not in phase one or two, but probably in phase three. The integration from with the other referral type clinics, but certainly um, integrating within our own system and within our clients with whatever software they're using to incorporate into ours. Integration yet there, yes, but I think probably phase three would be with the referral clinics.
So do you also work with different vendors in, for example, technology vendors? And one big thing is data security in what you do. So do you also bring in external vendors to, for example, assess the situation, assess the data, help you with compliance part of the things, or help you with documentation, or, for example, just give you a good insight on how scalable you
No,
are?
we have
Are
a
you working
vendor
with
that
vendors, or
manages
do
our
you have
internal
in-house?
IT needs. The software for OptiCare Connect is hosted by the company that we contract with. It's entirely hosted.
Understood. So if we talk, Frank, about your big picture, your vision, your mission, for example,
The
three
big
years
picture
from
is
now on,
continued
where you want
growth
to be with OptiCare
and
Connect. So what's the big picture
to
for you?
have our own software platform that is able to um, perform the predictive analytics and provide a dashboard for our clients, have easier access points for our clients. Currently, it's a manual process, so they would call into us, and we would create a visit and send a link. So kind of eliminating that, whether it be through a website or an app where they can log in directly. You kind of take a couple of steps out of the process there, and the goal will be, of course, to provide the best care as soon as possible. Um, while working towards the predictive analytics for our clients and just the data views that they're asking and of which they can alter on their ends to meet their needs.
Understood. So is it safe to assume that, as you said, integration is maybe in phase three or phase two? Is it safe to assume that you are looking ahead to get started on predictive
Yes,
analysis
very much so. That
plan you have during this
that is
year
one
or
of
phase
the goals
one?
that we
Is it
have
safe
is
to assume
to
so?
certainly be able to offer that to our clients. The market will tell you where you need to go, and this is certainly what we're hearing from clients. They want more data and not less, for sure.
So, from your experience point of view, Frank, what you feel is the best approach for challenges like this or situation like this? Already built-in plug-to-play tool, plug and play tool, or
We have gotten
something
this
that
far
should be
on
built
a
from scratch?
off
So,
the
in your
box plug and
experience, what
play,
works best for
and we are
situation like this?
utilizing this differently probably than anyone else that they're licensing the software to. I think it was meant for primary care doctors to utilize during COVID. But it has served us very well because it offers us the most options and most tools. Um, the future, we're in such a specific niche that I just don't think we're going to be able to find a off the box, off the shelf type solution. I think it would behoove us to build out exactly what it is we're looking for.
Absolutely. I understand that your point of view, and you're right. It's a small niche. It's not something that a lot of companies are looking forward to. So yeah, this can be the right approach. Frank, I want to ask you about your you are co-founder for this company, and you might be hiring and bringing in a lot of people in or workforce as needed. So, how do you ensure the culture of excellence within your organization in your workforce?
Well,
What are the key principles or core
me and my
values on
partners
which you
all
operate
lead by
yourself,
example.
and you expect your team
We
to
hire
be following
the
those?
um, people who fit into our culture, have the same work ethic that we do, pay them well, and um, provide probably better staffing ratios than any of our competitors. We want to make sure that they have the ability and time to provide the level of service that our clients expect. Um, and so when we find the right people and bring them in, we pay them well and make sure that they don't feel that they're being overworked and abused while they're here with us. And that has afforded us a level of retention that many of my or many of the colleagues in the field would be envious of.
Understood. So, how do you keep up with the training needs of your workforce? Training needs in terms of, for example, changing technology trends, but more importantly,
Training
helping
we
them
do
equipped with
internally.
modern workforce
I'm
challenges,
referring to
especially
the
around
medical staff
burnout
here,
and
obviously.
other relevant factors.
There are certain amounts of continuing education that is required to maintain licensure. They do that, of
Yeah,
course.
yeah.
We all do.
Thank you, Frank. I think we have gathered some great insight into OptiCare Connect. Your principles, your how you in technology right now. And the most important thing, you have a great roadmap in order to improve your services. You are looking at the right tools and right approaches to bring into your organization. And I think your big picture vision is blending technology and improvement of computer systems, which is really good because I think a lot of founders they have big picture vision purely on in terms of numbers. But what I think you are looking for is bringing in the right tools to help you reach where you want to be. So this is a really smart and great thinking from your side. And I think I really loved our conversation. I really appreciate you taking out time.